Hello, everyone. My name is Shellie Tingle. Welcome to the identification of patients with anxiety due to severe acute respiratory syndrome coronavirus 2 pandemic. I want to first introduce you to my committee members, Dr. Boniface Stegman, my DNP Project Committee Chair, and Dr. Dorothy Carlton, my DNP Project Community Member. This project was designed to increase the primary care provider's actions in the identification of anxiety and depression in the primary care patients and improve referrals to mental health services as indicated by positive screenings. The severity of SARS-CoV-2 pandemic has caused disruption, fear, uncertainty, and turmoil throughout the world and has had a negative impact on society. This pandemic has disrupted the daily lives of billions across the world, from job loss, telecommuting for work, students starting all online classes, the wearing of face masks in our daily lives, grocery shopping online, and social distancing. These changes in daily life routines have caused anxiety, stress, and depression. There is a growing need for implementing a screening tool for primary care providers to provide their patients care by identifying anxiety and depression. Nursing. Nursing is the primary profession that has been impacted by the SARS-CoV-2 pandemic when it comes to caring for patients. This pandemic has caused us to have to treat patients via telemedicine, providing drive-through COVID testing, and limiting family members' involvement in, in the care of their loved one due to social distancing. Assessment screenings for anxiety are essential as they can provide initial identification of anxiety, which can lead to proper diagnosis, treatment, and management of these mental health conditions. Anxiety does not only lead to depression, but it can also lead to fear or terror, panic attacks, outbursts of anger, and suicide. By conducting an assessment screening, we can bridge the gap with mental health needs by referring high-risk patients to mental health services. Social determinants have had an impact on mental health disorders and social gradients, including stress, home violence, and perceived lack of control. There is a correlation between anxiety or depression with living conditions, abuse, neglect, unemployment, and limited opportunities. Financial insecurities play a major role in where a person resides. As if we look at the urban community, those individuals may have the opportunity to work via telecommuting versus the rural communities who are primarily blue collar workers. They have no options to telecommute and they've had job losses. Screenings in primary care can provide successful early interventions for anxiety and depression by enabling providers to diagnose and consult referrals to mental health providers. The Patient Health Questionnaire 2, also known as PHQ, ASQ2 is a self-reporting tool used to screen for depression. The Anxiety Symptoms Questionnaire, also known as ASQ, was designed to be a self-reporting tool to measure functional impairment due to anxiety. The ASQ measures the frequency and intensity of anxiety symptoms, which focuses on physical symptoms across age and gender groups for a dimensional approach to assessing anxiety disorders. Anxiety and depression have been underdiagnosed due to patients not being appropriately screened. The primary care setting is where patients seek initial help for mental health concerns. The use of depression screenings supports the early identification of depression and referrals to mental health providers. The research identified the absence of documented mental health screenings, as well as the absence of documentation on referrals to mental health providers. The theoretical framework model used was Lewin's change theory. The change theory was developed by Kurt Lewin and has three major concepts: unfreeze, change, and freeze. Stage one is the unfreezing stage, which involves understanding that the change is necessary. Stage two is the change process of transition, which is needed to move towards a new understanding. Stage three is the freezing stage, which is about establishing stability once the change has been made. This stage is about ensuring that the desired change is developed, maintained, and supported. The Lewin change theory facilitates and guides the project in exploring formal practice changes in primary care by using the anxiety symptom questionnaire in addition to the patient health questionnaire 2, compared with the use of the patient health questionnaire 2 alone, resulting in more referrals to mental health service. Lewin's change theory framed and provided insight to the quality improvement study by addressing and increasing mental health service referrals. The pre-intervention included all patients who were seen in the clinic between June 1st, 2021 through August 31st, 2021, and participated in the Patient Health Questionnaire 2. The post-intervention included all patients who were seen in the clinic between September 1st, 2021 through November 30th, 2021, who participated in the Anxiety Symptom Questionnaire in addition to the Patient Health Questionnaire 2. Both pre-intervention and post-intervention included 154 participants. There was an overall total of 308 participants in this study. This study took place at a federally qualified health center, primary practice, located in the Southwest region of the United States. Minimum necessary data was used to accomplish the goals for the project on the data collection sheet. All potential patient identifiers were removed and were not collected for this project. A quantitative exploratory design was used utilizing a retrospective chart review. A Microsoft Excel data collection sheet was utilized to capture both pre and post interventional data. Microsoft Excel was used to create a yes or no data collection sheet to create the ratio. The type of statistical data which was used is quantitative nominal data using yes or no answers to create the ratio. Nominal data were analyzed by using the model in the measure of central tendency. In statistics, central tendency allows the researcher to create a statistical summary of the data being analyzed. The data used were abstracted from the clinic's electronic medical record from the adult patient population. The age of the patients was 25 years of age to 65 years of age. All genders were included in the data collection process. The statistical method which was used is a z-test. The z-test determined if the distribution of the pre-data and the post-data means had the same or different variables. Chi-square statistical analysis was used to show a relationship between the two categorical variables. The data collection was non-numeric categorical variables to show an established relationship between the two variables. The t-test was used to analyze the large scale of data for correlation and efficient computation. The upper tail z-test for the difference between two proportions was utilized and shows a pre-intervention of 20 participants being referred to mental health services with a sample size of 154 using only the PHQ-2 screening. Post-intervention shows 130 participants being referred to mental health services with a sample size of 154 using the ASQ in addition to the PHQ-2 screening. The level of significance of 0.05 indicated a significant change in the validity of the project. The confidence interval estimate of the difference between two proportions. The confidence level of 95% suggested there was a variation in proportion between pre to post intervention data. This study's standard error of difference between two proportions was 0.0399 as it quantifies uncertainty. The confidence interval was used to indicate the uncertainty in estimating the true mean, with the lower limit being 0.6362 and the upper limit being 0.7924. To compute the achieved power, a one-tailed test with the error probability being 0. Sample size groups 1 and 2 had 154 participants. The calculated power of 1 beta was 1.0000, which indicated a high probability of rejecting the null hypothesis. Patients referred to mental health services exhibited the score of the participants and is an interpretation of the evaluative comparison with the referrals to mental health services in blue and the non-referrals to mental health services in orange. The total number of surveys evaluated for the study pre-intervention was 154. The total surveys, 20 patients were referred to mental health services. The total number of surveys evaluated for the study post-intervention was 154. Of those surveys, 130 patients were referred to mental health services, showing a significant increase in mental health referrals post-intervention. A communication language barrier was presented during the research project. Spanish-speaking clients presented to the clinic who were included in the project. To overcome this potential limitation, the ASQ and PHQ-2 tools were presented in Spanish, and a language line was used via an iPad, not only for verbal communication, but nonverbal communication with the patient. The most significant limitation of the study was the clinical shortage of psychiatrists and mental health nurse practitioners in the clinic setting. Telemedicine was utilized in several cases as referral rates increased. This project determined that by combining the ASQ and PHQ-2 in the primary care setting, patients' mental health can be positively impacted by the early intervention of mental health referrals. This study's outcomes offer the opportunity to refine research and validate the concepts that emerged from this retrospective chart review. Healthcare policy changes could improve the emphasis on effective mental health screenings and referrals to mental health towards increasing positive mental health outcomes. The intention is to improve the effectiveness of these methodologies to enhance validity and reliability. The study findings show significant implications for future research and healthcare policy changes. Future interventions need to be centered on the collaboration with the primary care provider and the mental health provider in identifying, referring, and monitoring the mental health patient to improve their overall quality of life. The implementation of the ASQ and PHQ-2 in the primary care setting can increase referral rates to mental health providers to integrate and support patients in the early stages of mental health. Identifying the early stages of mental health illness can improve treatment options and optimistic mental health outcomes. With the impact of the SARS-CoV-2 pandemic, along with other life stressors, it is important to identify patients with anxiety and depression in the primary care setting. With the appropriate mental health referrals, mental health providers can work with these patients to improve their quality of life. In reflection, additional areas of research could have been implemented with patients. Follow up on mental health referrals. Areas that could have been included are what medications were prescribed, if any, if patients receive therapy alone or a combination of medications and therapy, if there was no indication for mental health services after the initial consultation. The research conducted can function as a model for the development of future projects on promoting depression and anxiety screenings in the primary care setting, resulting in significant improvements in the identification of anxiety and depression within the primary care practice and for referrals to mental health services for appropriate management. Thank you for the opportunity to present my scholarly project. The forum is now open for questions.